Everyone. Thank you. Dear guests, please join me in welcoming Her Excellency, the First Lady of the Republic of Rwanda, Mrs. Jeannette Kagame. Not yet. Oh. And as she's making her way to my other colleagues, Honorable Minister of Health, Diane Gashumba, other government ministers, chancellors and vice chancellors, esteemed participants, friends, and global health advocates. Welcome back from the break. We hope you are able to continue the discussion from some of the topics. Absolutely. My name is Dr. Christine Garuya, and I will be the MC for this plenary panel discussing women's health and gender equity 25 years after Beijing. Moderating this Women's Health panel is Peggy Clark, Vice President of the Aspen Institute and Executive Director of the Aspen Global Innovators Group. Peggy has had a 30-year career working on issues of poverty alleviation, global health, social enterprise, and development finance. Currently, Peggy directs a portfolio of programs promoting breakthrough solutions to global development in the areas of health innovation, leadership, and entrepreneurship. Peggy received a Presidential Award for Excellence in Microenterprise from President Bill Clinton and was instrumental in passage of the WHO Global Code of Practice on the ethical recruitment of health workers. Please join me in welcoming Peggy Clark to introduce the panelists.
Thank you, everyone. I appreciate that, Christine. I understand there was dancing and music. Did we miss it?
All right, and while we're waiting for the Honorable, for Her Excellency, we're gonna give a little bit.
Okay, perfect, thank you.
Maybe a little bit more dancing? No, I'm just kidding. We're not gonna dance.
Okay.
Okay.
Would you like me to wait for her to join?
Yeah, we're just gonna wait a little bit. Feel free to continue discussion with your friends for the moment on all of the important topics we had this morning.
Like a knight. And then Fisa. Okay.
I should wear my global health next time. Let's go tomorrow.
Okay. That was just a trial, you guys. Now for real. We're so honored to welcome Her Excellency, the First Lady of the Republic of Rwanda, Mrs. Jeannette Kagame. Thank you so much, Peggy.
Welcome, everyone. Welcome, Your Excellency, First Lady. We're delighted to have you with us for this session on where do we stand with women's health and gender equality 25 years after Beijing. I thought that we were going to get Dr. Agnes to come up and lead us in dance, but maybe you've already done this. Is this right? Not yet. Okay, so stay tuned. I know we're all a little sleepy after lunch, but this is a really fantastic panel, and I am really honored to be able to introduce you to our panelists today and kick us off on our conversation. To my immediate left is the wonderful Sinead Fisa, Fissa, who is the Director of International Programs at the Buffett Foundation. She was the previous Chair and Director of Reproductive Endocrinology and Infertility and Medical Director of the University of Michigan Center for Reproductive Health. As many of you know, Sinead has spent her whole life fighting for women's rights and women's health, and we are so delighted you're here with us today. Welcome. You have a lot of fans. Keep up the good work. You brought them along. That's great. And then we have Dr. Paul Farmer, who, as many of you know, is a leader for us all, the founder of Partners in Health, importantly, the chair of the Department of Global Health and Social Medicine at Harvard Medical School, chair of Director of Public Health, director of Division of Global Health Equity at Brigham and Women's Hospital, and really a global leader in the question of preference for the poor in global health. Paul, we're so happy you're going to be with this panel and join these beautiful women. You will grace us with your male allyship, which you've already proclaimed. So thank you. And then we have Dr. Mwenya Kasonde. Mwenya is co-chair of Gender Equity, the Gender Equity Hub with Women in Global Health and World Health Organization. She also was the former Assistant Director for Global Health at the Ministry of Health of Zambia, and she recently returned to Zambia to take a big role in leading the transformative agenda that Zambia is undertaking in health right now. Her background is in emergency medicine, and she recently founded the Center for Global Health in Zambia, which the priority is to provide platforms for researchers and primary research from the Global South. So welcome, Mwenya. And we have Rupa Bhatt, who is with us. We're delighted you're with us. She's the co-founder of Women in Global Health, which was established in 2015. It has more than 25,000 followers in more than 90 countries and 10 hubs in 10 country hubs and soon to be 20. She was cited in Apolitical as 100 of the women working on gender equality to watch. So welcome, Rupa. I think this panel has a lot of fans in the audience, so we're delighted to see that. So let's take ourselves back. A quarter of a century ago in Beijing, more than 50,000 people, activists and delegates, made their way to a conference in Beijing, and many of the activists were shuttled to a place about 40 minutes away outside of the city for the 4th World Conference on Women, Peace, and Development. So this was arguably maybe one of the most important moments in the women's movement to date. It provided a platform of action which endures today and is really the blueprint and the guiding framework for all of the work we do on women's equality. It outlined 12 key areas, including women in health, women in poverty, the girl child, violence against women, political representation, and much more. So now, as we approach the 25th anniversary and 2020, and a set of activities that UN Women and others will take up next year, the whole world will be called to mobilize for women. And so it's a terrific opportunity for us to take stock right now and look at this question of how far have we come and where do we still need to go? Where are we lagging behind? So let's just start with the facts. Most of you in this room know this, you live it, you've worked on these things, but it's fitting that we start with that here in Rwanda. And as Rwanda was proclaimed one of the leading countries in the world to be a woman. It's actually in 2018, it was named the 6th best country in the world to be a woman, which is incredible. And it holds that spot with Iceland, Finland, Norway, Sweden, and Nicaragua. And it is in many ways, in large part, due to our own Dr. Agnes Binawahu, Her Excellency, the First Lady of Rwanda, you lead the way for the world in terms of gender equality. So it's fitting we're having this conversation here. So let's look at what we have been able to achieve and what we have not been able to achieve as we move into our conversation with the panelists. Since 1995, we've seen a huge 40% reduction in child mortality, really an incredible achievement. Maternal mortality has dropped 38%. Access to contraceptives is steadily continuing to rise from something around 54% to about close to 58% in 2015. There are many more girls in school. In 1995, the average length of time a girl spent in school globally was about 6 years, and now it's about double. It's about 12 years. Yet, there has been weak progress, and in many places, actually stepping backwards and regression in some key areas. And those include economic participation of women. It's not really advanced much at all, and in many countries it's actually gone backwards. Political leadership and decision making, it has also lagged behind, even though the world is graced now by more women presidents and ministers than we have seen before. And violence against women has not been significantly reduced. In fact, 1 out of every 3 women in the world have experienced violence in their lifetimes. So even in these areas of great progress that many of the people in this room are working on, there's so much more to do. 232 million women, estimate, who want access to modern contraceptive methods do not have access. 130 million girls are still not in school. So against this backdrop, how do we approach 2020? What can countries like Rwanda and all of the people in this room do to push more progress for women in order to make it not another 25 years before we see progress around the needle? So I'm delighted to turn to our panel, who happen to be a wonderful, diverse set of experts who have really spent their lives devoted to these questions. So let me start with you, Sunait. I'm so delighted you're with us. And you, as we have acknowledged, really have spent your whole life fighting for reproductive health. Where have we seen progress? What are the biggest obstacles? And what interventions can we take on that can show demonstrable gains that we are all longing for?
Thank you. Thank you, Your Excellency, for joining us, and Agnes for bringing incredible group of people in the same room on our continent and our soil for the first time to have this discussion. I'm just so pleased to hear that we're starting this conversation talking about reproductive health and where are we and what are the barriers. In reproductive health and more broadly in women's rights, if we look at in that space, the interventions that will have the most impact are not always the easiest to implement because they threaten patriarchy and they threaten the status quo. Mm-hmm. So they're going to take a lot of efforts to push that work forward. If you really look at it, though, there is no change unless there is, there's no change if there is no change. And I think we have to absolutely need to be more courageous. You shared a lot of statistics. One of the daunting statistics that I go to bed with and wake up with every day is 25 million women worldwide have unsafe abortion.
Yeah.
Annually, 25 million women. Of those, a lot die, mostly in the sub-Saharan African continent and few countries in Southeast Asia. And a lot of them live with severe morbidities. So in order to tackle that, we're going to need really radical measures, radical commitments, and unapologetic stance to fight for women to control their bodily, they need to have bodily autonomy, which means, in simple terms, legal, safe, accessible services to safe abortion, to contraception, to family planning, and not politicizing and religiousizing this basic services women need to self-actualize. Mm-hmm. So there are a lot of ways the global health arena has not delivered in this space. One of the downsides of global health and global development has been verticalization. as if women are their body parts and as if they live in silos, right? So a donor will come, a very specific program for one thing, and we tend to focus on the things that are not hard, right? Because who wants to do tough things and who wants to upset the status quo? So it's very easy to talk about what may be popular, what may be acceptable, and we shortchange women when we do that. So we've done enormous work expanding family planning, but we have really verticalized programs. So the same women who needs family planning and who has faced gender-based violence, and I really would like to take a moment to remember our friend Jennifer, who died yesterday. For those of you who know Jennifer, who's been a tireless advocate for women and reproductive health, who was killed along with her daughter by her husband. So women face intimate gender-based violence, women face harassments, sexual, women face physical harassments, but what we don't deal with is the consequence of these things. Many of us and our leaders and our champions are very comfortable talking about gender-based violence, but not the consequence of gender-based violence. What happens when a woman gets raped? Right? She acquires infections, she has unintended pregnancy, she turns into clandestine abortions. So these are all sort of, if you look at it, it's a value chain. It's a whole spectrum that we need to look at. So I think we need to be courageous. We need to really fight. We need to speak up. We need to give voice for the voiceless. So if we are going to look at the next 5, 10, 15 years, we need to take bold measures where we fight for women to access integrated services where they show up at a facility. And I think I will give a shout out to the health minister, Minister Diane Gashumba, and our First Lady in Rwanda, who are demonstrating where at a community level, women can go and get comprehensive services, where they can get family planning, antenatal care, safe abortion, post-abortion care, post-abortion family planning, counseling, the whole spectrum of. So I think more countries need to stand up, more countries need to push back on donor, religious groups, other driven agendas if we're going to stand up and speak up for women. Where have we seen progress? I think I talked about Rwanda, which is an excellent example. My own country, Ethiopia, has done a tremendous job where, although the law on paper said abortion is illegal, in 2006, the then health minister, Dr. Tedros, worked with the WHO to interpret the law so that the clinical guidelines were loosely interpreted so that young girls, women who are economically disadvantaged and are not ready to have children, psychological indications, mental health, physical abuse. If a woman says she's raped, she does not need to go to court. I mean, in many African countries, she has to go and get 3 doctors to sign when we barely access 1 doctor for emergencies. By the time she gets a court order, she's full term. Right? So we have unintended pregnancies, we have high rate of teen pregnancies. In short, what that means is we have a lot of girls whose dreams are shattered, who cannot be sitting in this room like most of us are and participate. Mm-hmm. So I think we really need to be intentional in our action and courageous in our decisions. Challenges remain. You did ask, what are some of the challenges. We all are here to celebrate as well as talk about challenges of women and what we face around gender equality. For me, it's really problematic when people talk about gender equality and equity and not include reproductive health. But I think also being mindful of women of color and women from the global south suffer much more amplified, right? The intersectionality of the issue. And for those of us who are in power to be sensitive and use our voice to uplift those who don't have the same privileges we have. So I think in addition to making services available, we need to be very conscientious around meaningful inclusion of women. And as I said, especially women of color. There are many ways for us to do that. Part of it is for those of us in power, knowing that when it is time to give up the mic, when it is time to give up and elevate other people, especially a lot of young people in this room. Using our resources as a funder, I can tell you we are critically looking at our funding. Donors in general tend to be very comfortable funding people who look like them, and unfortunately, a lot of the donors tend to be in the Western Hemisphere. So a lot of the money, at least 90%, goes to entities that are sitting in UK and US that are flying over 13, 14 hours to solve the problems in this continent. So I think we need to hold each other and others accountable about funding groups, small groups, and not using the excuse of there's no transparency, they don't have the absorptive capacity, they don't know how to do this. All the things that we list to justify not funding local groups. If governance and transparency does not exist, it's our responsibility to build it. So those are a few of the examples, and hopefully I want to give the others a chance to reflect as well.
Beautiful,
but I can
Sinead.
speak for hours on this topic.
Beautiful, Sinead. You're a powerhouse. Thank you, and we're also grateful for what you're doing. So, Paul, I have two questions for you. The first is, you've really devoted your whole life to actualizing this idea of preference for the poor. And we know that in every society, everywhere in the world, women are disproportionately the poor and the vulnerable. So why are we not making more progress? And in the places where you have seen breakthroughs for women, what are some of the key ingredients? So that's my first question, really just challenging your view of women in poverty. And then I want you to reflect a little bit on the role of education and how we're making progress.
Thank you. And thank you for, again, letting me be up here to express my allyhood, if that's the term. I think when we talk about Beijing, in 1995, I was thinking a lot more about Haiti and Rwanda, actually. And that was I was making all sorts of grim predictions from afar about Rwanda's future. And I've, in recent years, taken to confessing that publicly with some embarrassment. Haiti was also in the midst of great turmoil after 3 years of military rule after a coup. And looking at what happened and what didn't happen in those years, again, we've been thinking of from Beijing, but following Rwanda and Haiti, where did things go well? Where might they have gone better? Obviously, Haiti had another setback, which was the earthquake. That'll be 10 years ago now. But these are empirical questions that are amenable to study. I mean, it doesn't sound very fire and brimstone and exciting. It's amenable to study. But we can look back and say, well, what were the policies that were pursued here that led to the outcomes that we're extolling today? And the same can be done in Haiti as well. And I think we should spend more time doing that if we're going to say, why are we behind? Because, if we don't have a way of measuring where we're going, I think we're going to have to conclude we're behind and failing. And I think maybe some sterner metrics would be warranted. Maybe we need to entrap ourselves into decency with more legislation. In other words, make it mandatory that salaries be distributed equitably, that there be no gender distinction in terms of income, or other access to the material fruits of society, because that's what we need to be tracking. With a certain sort of fierce materialism. Are women getting their fair share? Right.
Great. Did you want to reflect on the question of women in terms of education and progress or lack of progress?
Well, I'm thrilled, by the way, I said this morning that the University of Global Health Equity is hosting this. That's a pretty big marker of where a number of us have cast our lots with the university as a formal response to gender inequality. And that is because we believe that we can constitute a faculty, a staff, an administration, a relationship with a community, a surrounding community, a student body, and they're all here, by the way, that we can envision a university that's focused on equity, on health equity, and that will be an important way to make a difference. Back to your question about the role of education. I mean, at no point have we, in the last 3 or 4 decades, have we doubted the claim that we make that a girl's education is the way to lift people out of poverty.
Right.
We believe that, and now we need to speed up that process again with some more stern metrics, I think.
Great. That's great, Paul. Thank you. Mwenye, let me turn to you. And can you help us think a little, and really picking up on what Paul just said, how can research and data be generated in a way that really effectively advances progress? And, more than just progress, I know that you have put your hat into the ring of transformative progress. So reflect a little on what you're doing in Zambia and your perspectives on that.
Thank you so much, Peggy, and thank you for facilitating this very interesting discussion. And I do really have to commend our distinguished delegates and participants for being here and for showing their support. So I think, to me, the most important thing that research is going to do here is to establish the areas of need. You've asked me the questions, where are the areas of need? And that's exactly why we need to do the research, is to establish those areas of need. And in my opinion, human resources for health is really one of the areas where we do need to focus on. I think if we're going to achieve universal health coverage, one of the biggest problems we have right now in global health is in addressing the lack of human resources for health. So just to throw a few numbers at you, we've established a shortfall of approximately 18 million health workers predicted by 2030. This will result in an annual cost to healthcare of about 500 billion due to healthcare workforce inefficiency. So again, human resources for health is where we need to focus, not just to achieve universal health coverage, but to improve women's maternal and child health, and to achieve the health-related SDGs. So the Gender Equity Hub, which is something that I co-chair, and the Gender Equity Hub, just to give you a little bit of background, was launched in November 2017 by the WHO and is co-chaired by Women in Global Health. And the aim of the Gender Equity Hub is to convene relevant stakeholders and to aid in transforming some of these policies. So this year, 2019, the WHO launched a landmark report, and the title of the report is Global Health Delivered by Women, Led by Men. And essentially, I would encourage
Say that again so everyone can hear what you just said.
Global Health Delivered by Women, Led by Men. And I would encourage you all here to look at the report. It's a very interesting read indeed. And essentially, what this was an analysis of the global healthcare workforce. And some key issues came up while writing the report. The first is that women make up 70% of the 200 million workers who contribute to the health and social sector worldwide. Women deliver health and social care to around 5 billion people worldwide. And women in health and social sector contribute around $3 trillion annually. And half of that is in the form of unpaid work. Having said that, women only take up 25% of leadership positions. So definitely, there's obviously a big problem here. And one of the things that we again try to prioritize in the Gender Equity Hub is trying to not just establish the areas of need, but see what we can do about it. So we've established 4 priority areas that we aim to focus on as we try to address some of these key issues. The first is occupational segregation, be it horizontal or vertical. The second is decent work, so addressing work that is free from discrimination, bias, sexual harassment, etc. The third is the gender pay gap, and also leadership in governments. So the research gaps. So again, doing this report, there was about 170 studies that were looked at to come up with this report, like I said, that was launched this year. And one of the key findings while we were looking at these studies is that data is lacking from lower middle income countries, and I'm sure that will be no surprise to many of us. And this is such a shame because, again, that's where the needs are the greatest. Data in certain areas was also lacking, particularly in the areas of sexual harassment and gender pay gaps. People don't generally like to talk about sexual harassment, and even few people like to write about it. We were limited in methodological approaches, so there was no real intersectionality. We considered gender, but we didn't consider race and social class. And also there was limitation in terms of establishing the impact of policy change. So these are all areas that the Gender Equity Hub tries to work towards. So to go to your original question as to where are we 25 years post-Beijing, so I'm going to take a slightly biased view in the sense that I am from the South, I am from Zambia. Generally, yes, women lead more political offices. Women are protected from gender-based violence, and more live under constitutions that guarantee gender equality. But of course, there are still some gaps. Now, again, giving a Zambian perspective, 2016, we launched the Constitution Amendment Act No. 2, which again confirms equal worth of women and men. So that was a very interesting piece of legislation for us. The Gender Equity and Equality Act of 2017 was also passed back in 2017. And also there's some fast-track courts that have been established in processing gender-based violence cases more smoothly. Now, again, to talk of some of the downfalls as well, one of the issues that we have in Zambia, and I'm sure a lot of people in this room will relate, is that we have a dual legal system. So we have the civil law and we have customary law as well. And customary law is just as much respected as civil law is. Customary law is led by traditional leaders, and it's still very patriarchal in its views. So some of the issues that we're facing here are to do with accessing lands, inheritance, property, and marriage, especially in the rural areas where people do respect the traditional leaders, where people do very much attain to the customary laws. But nonetheless, some interesting progress has been made.
Good. Thank you so much. That reference to customary law is taking us back to our very first session this morning when we were really thinking about power and women's leadership in a different way. Ropa, let me turn to you. How can we require countries to take accountability for progress for women? And what are the key challenges we're looking at as we move into Beijing Plus 25?
Great, thanks Peggy, and I just want to also acknowledge it truly is a privilege to be on this panel with esteemed people, role models, and also thank you so much to Honorable First Lady for making the time to join this critical conversation, and to Agnes for hosting this in Africa. It's a very special moment in time, and I want to frame it really thinking about when the Beijing Platform for Action was created. It remains clearly an inspirational document, but it was designed for a different world, and we need to acknowledge that. The Berlin Wall had just fallen. China hosted the conference, but had not emerged yet as a global player, and there weren't quite yet, inspirational media platforms for young leaders to rise. So I represent an organization which was founded by early career women, millennials, who found ourselves associating with this diverse global health community and wanted to change it. And one quite inspirational person to mention is that there's Greta now, and she's part of this scene for the climate movement. There is Malala, who's also part of the education movement. And so this is a different time when we look at Beijing 25 plus. Of course, we also need to acknowledge that the narrative has changed. Women are starting to be seen as change agents. Girls are starting to be seen as change agents. And that's really thanks to the work of all of you in this room and many others all around the world. But what are we going to really do with this? Social media has given us a platform, but again, social media can only go so far. And if we have to really think about what drives social change, it has to be the passion. It has to be really using evidence to drive policy action where it matters and getting to our communities. Particularly the Beijing Platform for Action, like ICPD, remains frozen in time there's been a fear that if we have the 5th World Congress for women, that it would reopen the declaration and that we would actually lose our rights. And as someone that was born with the most freedoms ever possible, my grandmother was arranged marriage, my mother has not had the ability to make all of her choices. I'm the first woman in my family that has all the freedoms I could imagine, which includes becoming a doctor, controlling my finances, choosing my own husband, and also going back to Professor Dr. Sanait's point, also my reproductive rights. And that's why I am here on stage today. But when we think about the unfinished business, we have to acknowledge what we're really dealing with. So what I would say, thinking about how we're going to bring the accountability to governments, I'd say it really goes back to mobilizing the citizens. Women must seek power. This is a conversation about power. And I know it's kind of uncomfortable, but if we don't really talk about the conversation that we need, what does male allyship really look like? It means about changing, transforming, shifting power. What does it mean for women of more privileged backgrounds? Myself being someone that I consider very privileged from Indian American, what can I do to shift power? And it's asking those type of tough questions. And this means that we know that women are at 24% leadership roles. We've heard lots and lots of numbers, but if we don't start having those conversations of how do we transform power to be more equitable for all, to be part of the Global South conversation, then we're really not going to achieve much moving forward, and we'll be probably still in a stuck agenda. And I don't mean to be dire. I promise I'll be inspirational. aspirational as well. And, start and join movements. I had the opportunity to speak to many of you in 2017 when we launched the Women Leaders Conference with the Stanford University leadership, and I'm looking for Dr. Berry to acknowledge the brave role right there for what she did at that point in time, changing the status quo and saying, let's have the first Women Leaders Conference. And it was so energizing. And thinking about 3 years later, in front of all of you, and being myself a co-founder with 4 other women of a women's movement advocating for gender equality and women's leadership, we really need to tap into all sorts of movements. We need to tap into the women in global health movement. You're all invited, the women leaders, the climate change movement. But without that, we're not going to shift and hold governments. And I think it's not about holding governments accountable, but working in partnership with governments. There can be a more constructive dialogue. We've seen the power of Me Too. Finally, it's not such a taboo in some parts of the world to talk about sexual harassment. People are finally feeling comfortable to acknowledge this as an issue. I've had so many conversations with various deans of schools of medicine in the United States saying to me that, harassment is not an issue. And it's fantastic that we finally have data in the United States that it's occurring probably up to 30 to 50% of all young women in training in science are facing harassment, sexual harassment and bullying. But unfortunately, we don't have that data in lower middle income countries. And going back to Moena's point, we really need to, again, think about how do we take the energy in this room into action where it matters. So I encourage all of you to really join movements, be part of movements, be part of active members in your associations, and start really building the energy for Beijing 25. And we know there's energy, but we all need to be part of it from a health community. And I have to also acknowledge the great leadership here in Africa. Nelson Mandela has said, it always seems impossible till it's done. So I'm going to say that one more time. It always seems impossible until it's done. And I hope you're convinced that you will be part of achieving the goals. And I also want to quote Her Excellency Sirleaf Johnson, who says that women are the catalyst for real change in Africa. And I want to do a round of applause for that particular acknowledgement, because it's so fantastic to be in a continent where women are leading in so many key roles and driving the change.
Thank you, Rupa.
And I'm going to, one last point, Peggy. I know, I'm so energized. And it's because it came unexpected to be on this platform, so I want to make it the most of it, and being a little disruptive, so please, thank you for that. But I just want to also acknowledge that this year, we passed a high-level political declaration at the United Nations on universal health coverage, and I've been carrying it around everywhere I go, and I'm going to continue to do this because I'm very proud about the political tools that we have now today to advocate for gender equality. There are 2 key points in this document. One, there's clear language about women's rights and sexual reproductive health and rights. We would have wanted more, but clearly there was pushback, and it took the mobilization of leaders, many on stage here, but many in the room, and many not here. And there's also clear language about women being acknowledged for the first time as the health workforce, a truly gender mainstream document. And it took the work of coalitions and alliances, and I really encourage all of you to tap into that power. And in closing, I'd like to say, let's stay committed, have the political will, let's continue to have citizen awareness, engagement, and mobilization. And then as we are at this conference, really let's launch the call to action to finish the unfinished business, especially when it comes to women that are left behind, and not think about them as the afterthought, but as leaders in their communities, and make them part of our dialogue. Thank you.
Thanks. Thank you, Rupa. So I want to turn to the audience and allow to have some questions. Do we have someone with mics? Okay. If you could raise your hands, I want to have the panel also, for just a moment, reflect on a question we're going to come back to later, which is, can the SDGs get us there? And are the complexities around women's progress, as you mentioned, needing an intersectional approach, verticality, just reflect on that for a little bit. But this woman in the front, in the blue, was one of the first. Let's take 3 questions, and then we can move to the panel. This woman right here can be second. So please, go ahead.
Thank you so much.
Would you mind standing up so we can hear you a little bit better? Thank you.
Thank you so much. I'm Dr. Shabnam, and I come from the Ministry of Planning and Commission, Government of Pakistan, and I'm also the Harvard Global Health Lead Fellow at the Harvard Global Health Institute. There was a very important point which was raised by, I hope I'm pronouncing the names well, my apologies beforehand. Faseha talked about donor assistance. And then Dr. Paul also
Could you put the mic a little bit closer? We're having a little hard time hearing you.
So
Please try
Faseha
again.
talked about donor assistance.
Thank you.
And Dr. Paul talked about measuring, the measurement part, which is very, very important. We heard about the evidence which is around, gender equity. I just wanted to hear some recommendations. How could this donor assistance be more geared towards sustainable health systems, towards health system where women have equal opportunity to climb up the career ladder? So how would we be measuring that? So, I mean, if we could have some thoughts around it, because I think that's very pivotal for us to make progress on this important ground.
Great
Thank
question.
You so much.
Thank you. Good. Let's take right here in the front. And then in the back, I see that energetic hand over there. You guys look so beautiful. There's such a great audience. Please, go ahead.
Good afternoon. Thank you. My name is Marie Deschamps. I'm a medical doctor in Haiti, and I'm a deputy director of a Rescue Center, which is one of the main HIV centers, and work closely with Paul Farmer team in Haiti. And my question is addressed to Paul or whoever could answer that. Haiti had a lot of difficulties, but I could say that our program focusing on HIV, malaria, tuberculosis, and even cholera had been a success. But Paul, what is it we need to do for the women's program to move forward? What are the main obstacles as you have been coming down so often and working with the leaders, the political leaders, why they cannot move forward? What's stopping us?
Mm-hmm.
Thank
Beautiful.
you.
Excellent. And then that woman who's waving her hand in the back, can someone bring a microphone over to her? Okay,
Thank
so
you.
now everyone's waving their hand. I think that might help. But this gentlewoman in the green, please.
Okay. Thank you. My name is Saleli Calderon. I'm from Mexico. So I'm glad that two of you talk about the sexual right for women. So actually, I have my green here. In Latin America, we are one of the most criminalized regions in the world about abortion. It's illegal for any reason in a lot of countries, especially in Central America. In Mexico, we just get 2 states with free and legal abortion. And actually, I have a question for any of you who wants to answer. One is related with the criminalization of abortion, but there is also a social decriminalization that it's linked strongly with stigma and affect in a lot of women's lives. And so this is a question. How can we, as women leaders, can promote the access, even if it's legal, how to promote the social decriminalization of abortion? Thank you.
Thank you so much. Good. So the first question was around donor assistance. Can I put that one to you, Sinead?
Sure. Thank you, Commissioner, for your question. It's a very complex question, and I think the bottom line is how do we, if I understand it correctly, one is how do we put donor assistance into a health system, broader lens, so that we have sustainability, and two, how do we build career ladders, particularly for women within that system. And again, I may sound like I'm biased, but the country that I've worked the most in and where I'm familiar with that has done this really well is Ethiopia, and I would like to hear from other colleagues. Unfortunately, when you're a recipient country with enormous need, you tend to be dependent on donors. And usually donors come with their priority. And, we're enormously grateful for donors, especially philanthropy, bilateral donors, for doing this good work. So we tend to accept whatever they bring, and it does not have to be. One of the best examples of this is Ethiopia. Ethiopia has enjoyed enormous leadership in the health sector, starting with Dr. Tedros, then Dr. Kaseta, and now Dr. Amir. And in 2005 or 6, when they were trying to deliver on the MDGs, and every donor was coming and saying, jump, and every African health minister says how high, we're getting in this vicious cycle, and that's where we are now. And whether it's Haiti or many other countries, because you develop vertical programs, that you build that shiny clinic for HIV that is fully subsidized while the rest of the system is crumbling, the moment that money gets withdrawn, when donors think you're doing good, the system collapses. So countries like Rwanda and Ethiopia, what they have done is they really have developed a national strategy, and donors have been, Rwanda mostly has been done, with government leadership and some donors. Ethiopia continues to still heavily rely on donors, but in 2006, they established what they call the Millennium Development Goals MDG Pool Fund. So what at that time Dr. Tedros did is he said, here are the 5 diseases that affect 80% of my population. HIV, malaria, TB, maternal health, and child health, dysentery and infections and what have you. So he said, here's what I'm going to prioritize. So every donor that comes to work with me, and here are the components of the health system. I want to work on health extension workers. The country had 100 million people with very few doctors, at that time less than 1,000. So while training doctors became a long-term strategy, he knew he wanted to develop large workforce, so he got into task shifting. But he also built the gender component for it. So he built close to 40,000 women health extension workers with a career ladder built into it. That way they can graduate after so many years and have a ladder to be a longer program instead of a 1-year training to a longer, a nurse, even to medical school. So that was done very intentionally. So when donors come, of course, at the beginning, donors are reluctant, right? But in addition to the pooled fund, he created what he called one plan, one report, and one budget. And that was the country's plan, report, and budget, and not every donor's. So I think we need, again, courageous leadership from the continent and in Southeast Asia and Africa, where countries need to be on the driver's seat and not just respond to donor demand, but it requires intentionality. But for me, when you look at the successful countries, whether it's Rwanda or others, the key component is political leadership, political will, and leadership.
Yeah. Absolutely. Beautifully said. The next question was around Haiti and women. Paul, can you take that?
Sure. Before I do, though, I'd like to just pick up on this question of how to evaluate how we're doing around career paths for women. If you would have said to me 20 years ago, you'll be spending a lot of time worrying about this, what are the paths for promotion inside academic medicine? What are the paths for promotion in global health? I mean, there are obviously people like Michelle and many others here who have been thinking about this for some time. So maybe not 20 years ago, but by 15 years ago, it was quite apparent to even slow people like me that we really needed a radically different set of criteria and objectives inside academic medicine. I mean, just compare, for example, the student body with the senior professoriate, and you can imagine the challenges. And one thing that I would say, looking back over 10 years of pushing forward a gender equity, really an effort to remake the way the senior professoriate looked, which was a tricky thing because you're not trying to get rid of your friends, you're trying to bring in new friends. But we should have tough criteria around that. How many new, what have we done in this last year, and the year before, and the year after? I think that micro analysis, even though it sounds so absurdly lavish to worry about a university system with all its bells and whistles and tenure, but that's what we're trying to do with UGHE as well. The dean and the vice chancellor have been pushing forward a fairly deliberate way of assessing how does gender equality fit into the programming, the culture, the way that the faculty interacts with the staff and students, et cetera. So I think we should go for the very micro. And one thing to say about Haiti, first of all, there are just so many of our friends here from Haiti. That's one of the bigger delegations.
Yay.
You know, Haiti has always been such a beacon in one way or another for the last 200 years on this continent. That was the case. Some of the first conversations I ever had with Agnès 20 years ago were about Haiti's storied history. And the reason I'm going off a little bit topic, Marie, is because I think when there have been discouraging developments in Haiti recently, but the overall trend that you and the people here who represent the NGO sector, some are parliamentarians, we have journalists, physicians, nurses. It's a great delegation with enormous talent. Sometimes we forget just how much Haiti gets done in spite of all of these.
Yeah. Good point, really great point. So the last question was around criminalization of abortion.
I was just getting started.
Oh, sorry, Paul.
No, I just want to say.
Carry on about Haiti, please.
And I just want to say, think about the first CCM in the world. That was up in Central Plateau, Haiti. Think about the first programs, federally or funded programs to treat people with HIV disease in resource-poor settings. Haiti's been at the forefront of that. Think about the fight to get cholera vaccine in the middle of that dreadful epidemic, not just for yourselves, but for other places like Yemen, Sierra Leone, and the Congo.
Mm-hmm. Beautiful. I never want to be in the position of cutting you off because we learned so much from you.
So I'm just saying, vive Haiti.
I would listen to you, yeah, vive Haiti. I would listen to you all day if I could, Paul, you know that. So let's turn to that question of from our Latin American colleague around criminalization of abortion, and then the phrase she used, social criminalization. I know, Sinead, you probably, but would you like to comment on that? Why not? Or do you want to take the abortion question?
I'm always happy to take abortion question, as you know. Thank you for boldly and courageously raising that question and wearing your green scarf. Although Argentina failed to legalize abortion, the movement continues and the fight continues, and that's what we need to do. Certainly when Mexico City liberalized abortion in 2006, while it was celebrated, it also gave birth to the Mexico City policy or the global gag rule that you all are aware of. That pushback was reverberated throughout the country, where a lot of the states criminalized abortion. And as our colleague mentioned, a lot of Latin American countries have criminalization, so do many African countries. But if you truly analyze this, there are only 5 countries in the entire world that strictly ban abortion for every indication, i.e. even to save the life of the mother, which means almost in every country there is some indication. It is the social stigma that our colleague pointed out, the provider bias, and society's values as to when and where a woman should have a baby and when she should have a baby. Instead of that being her control, it is her mother-in-laws in Pakistan and India, it is the neighborhood in Africa, it's the kind of a menu of choices instead of the woman's choice. So I think we need to tackle that stigma. And there are so many ways to do that, but one of the things that's happening in the US right now is a movement called Talking About Your Abortion. Abortion is a fact of life. 1 in 3 women, i.e. if I start counting, I won't do that in this room, 1 in every 3rd woman has had abortion. That happens for various reasons. I mean, one of the most common forms of abortion is spontaneous abortion. As an obstetrician gynecologist, I know that 20% of pregnancies end up in miscarriage for whatever reason. Your body just gets rid of them. That is a form of abortion that happens spontaneously. And there is induced abortion, where that happens by choice when women are not ready for that pregnancy or have fetal anomaly or whatever. But women, because of the stigma from society, we don't talk about that. The same way we have gotten much better talking about cancer. For many of us who come from a culture where we don't talk about cancer, we need to do the same and normalize the conversation. So when you create movements like that is happening in Argentina, when those of us who work in the international arena, have the humility to listen to people on the ground who know how to talk about this. The biggest challenge I see in the abortion movement is those of us who fly in with terms and conditions that are very Western and available for our culture, and come to a country and not understand how they talk about. I mean, these people live the lives that we're trying to fix. They know the struggles, they know the language, so we need to bring our humility and be allies and enable them to create movements and have them lean on each other, so that when they're attacked, when they're stigmatized, when they're beaten up, that they have someone to rely on. But I do agree with you, in addition to just waiting for our political system to solve this problem, we need a massive uprising of angry, disappointed, loud women who go out and demand that they have the right to control their bodily autonomy, and decide when and if and where to have a baby.
Great, beautiful, thank you. I want to make sure you guys have great questions. I haven't come this side over here. Anyone in the back over there that wants to raise a question? This woman right here has been very patient, as you have, so go ahead.
Gender balance.
We need gender balance. So
there's a guy raising his hand right there.
This hand right here, you can go next, and then the woman, thank you. Do we have a mic right here? If you could stand up, sir, we can bring a mic to you. Could you stand up? And there's a mic coming right there.
10 minutes left.
Thank you. 10 minutes left. Okay.
I must say, you caught me while I was eating a candy.
Oh.
Had to rush up. Anyway, good morning.
Good morning.
My name is William Savary. I am with the Haitian delegation. I listened with a lot of interest, references that were made to the traditional values, and comparison that were made with civil law and customary law. In Haiti, I'm involved in researching I do applied research on Haitian voodoo and Haitian economic development. I'm curious to find out if, within your experience in Africa, whether you have discovered or uncovered if there are impediments to the empowerment of women in customary law, and how would you compare those with civil law or the Napoleonic Code? Thank you.
Good, thank you so much. And this woman right here, could you stand up and they can give you a microphone? She's right there.
Zambia.
Thank you very much. My name is Joanna Galari. I work for Inshuti Mubuzima here in Rwanda. I've been reflecting on the silence as the language all women know. And I've been thinking, clearly it's not our mother tongue. It is something that we learn over time when we speak up and sort of hide away because the reaction is poor. And we also know that women are the greatest resource in global health delivery because they quite frankly deliver global health. So what I'm wondering, and this ties back to the donor resistance question, where are we going to find the resources and who are the donors that are actually putting their money towards protecting the greatest resource we have in global health? Because if there's a nurse in a rural hospital somewhere who is being sexually harassed by someone above her, what is a headquarter-based sexual harassment policy going to do for her in that hospital? And what is justice on her own terms, and what can we do in that way? And who are the donors that are willing to stand up to pay for that?
Great, great question, thank you. This woman right here, thank you.
Hi, I'm Dr. Maret Mandefro. And I've been thinking a lot, Paul, Women, Poverty, and AIDS came out 23 years ago. Blew my mind when I read that book. And I think about the present world today, and one of the things I've been thinking about is where does the locus of power lie in changing the patriarchy? Because something that's very clear is that we're really good at talking to each other in these kinds of formal settings. But when I think about the women I'm trying to teach, or the girls in Ethiopia, their lives are very much affected by the informal realities of culture. So where does that power lie to change that over time?
Great question. Thank you. Okay, we could do this. You guys have great questions. This is wonderful. So we only have 5 minutes left, but I want to make sure we can answer these questions and also have a little reflection for our panel. The first question, traditional and customary law. Do you want to take that one?
Yeah, thank you for that question. That's very interesting. I think the slight challenge that we have with customary law is that it's traditional. So it's traditionally led by men. Having said that, we need to address some of these issues, but at the same time, the hardest thing for us is how to address the issues, but still keep our cultural heritage, still keep our traditions. We don't want to get rid of them altogether. So one thing that we've done very well in Zambia is to facilitate dialogue. So we hold what we call religious and traditional leader indabas, where we sit down with our religious leaders, sit down with our traditional leaders, with the government, with different stakeholders, and have dialogues, educate the traditional leaders in some of these issues, and have those open dialogues.
Great, excellent question. So the next question was around the silence of women and this question of sexual harassment. And does anyone want to take the answer? Ropa, it looks like you might want to.
Yeah, I can take that one. So I understood it not just the silence of women, but really the ineffectiveness of our organizations to really get to the places where some of these things are really taking place. They're not being measured, so they're not being addressed, right? That's what it comes down to, bottom line. So I think it really goes with some of the key messages this panel has already talked about, is that we need a political will and top leadership to commit, but when it really comes down to it, you have to effectively do gender mainstreaming. And that means from designing programs, it's seen as an investment of how a program is being effective. Oftentimes, gender is seen as an afterthought, so I'd say everything that's happening in global health should have gender as a cross-cutting issue, not a standalone interest issue. And what we've seen is when we look at any study that's been done on investing in gender equality, it actually improves investments. A return on investment, if you create one job in health workers, you get 2 to 3 jobs in other sectors. There's a 9-to-1 return on investment when we go ahead and invest in health workers specifically. The World Bank released a report that there's $160 trillion we're missing out in human capital when we don't do that. But this is happening at the global level. I think some of these things have to translate into how programs are being designed and making gender cross-cutting from design, measuring it, tracking it, and also being comfortable for audits to take place, but also doing this design not from the top perspective, but from the grassroots. And I think some of those messages here were clear, that we don't bring the people most affected into designing, understanding the problems and designing the solutions. Until we start doing that, we're going to keep going in this circle and not addressing it effectively. Thank you.
Good, great, excellent, thank you. The question on women in poverty and AIDS and the reflection on power. Paul, do you want to start that off?
Well, first of all, thank you for remembering our ritual. Yeah, 23 years ago. Let's just say it was not a big bestseller. Although I thought it had a cool subtitle, Sex, Drugs, and Structural Violence. But, you know, it does get to the question of, it was a philosophical question, which didn't surprise me. How do we get at this, you know, the cultural change that is difficult to predict, how it will come to pass, difficult to hope for the right outcome. We do have desired outcomes. And that was a pretty obscure exercise, right? Women, poverty, and AIDS. A group of us get together, take a feminist lens to the literature, whether it be clinical literature on HIV, where this book was called Women, Poverty, and AIDS. But it was just meant as one part of a contribution. And that would be work with high school students and work with, you know, university students and work. I teach at Harvard, but I also teach in Haiti and Rwanda. And so, you know, I don't know how we're going to measure the culture change we want, but I do know it's going to require multiple ways at getting at this. Again, the arcane questions of how we promote women in leadership and in global health, to rudimentary literacy for women who are clamoring for that. And I think it's just we have to have many ways of getting this message out.
Right. So I just want to end with one question. I know we're going over time a little bit. We had that funny false start, so I'm going to take the chair of the prerogative. Well, 1 second. So I think the question I want people to reflect on is, where do we stand after Beijing plus 25? And picking up on that point of what's really cultural change, and the point of the complexity of these issues, and the lack of verticalization is not taking us there. Can the SDGs take us there? And what are your thoughts about what needs to happen in order to make progress at this 25-year point? Sinead, let me start with you. Sinead.
Thank you. I think before I answer to that, there was, as part of the sexual harassment question, our colleague has asked, what does policy at the central level or headquarters mean to a woman and a girl who, in a far away place where basically she has no agency and power, how's that going to protect her? And who's going to be the funder who's going to stand up for that? And I think that ties to the question Dr. Mehret Mandafro asked, how do we measure culture change, right? So part of where donors have gotten away with is saying, we're not going to do the hard work that's hard to measure. And those things are very hard to measure. Culture change is a very complex, long-term investment, and the mantra of global health and development has been, what you can't count, you can't fund, right, if you can't measure it. So one of the things we need to do is make that shift. And I think that ties to your question. When we look at the next however many years, 12 or so, or 10 years to get us to SDGs, or Beijing, whatever. We are very good at getting together and coming up documents and giving them names and convening. In fact, if I make a pitch, I try to be very selective which meetings I go to, because I feel like a lot of global health has become meetings instead of really kind of looking at the lives of the people who are being affected every day. When I look at the amount of money we spend meeting, talking to each other, and convening more meetings to convene, boy, right? So that's a problem. But I think I also want to leave, especially the young people in the room, with the fact that we really have to examine our implicit and explicit biases. If we're going to make progress, will the SDGs get us there? I mean, I will be speculating. We're already far behind in health. So sure, I mean, we want to accelerate and do all sorts of, WHO is doing the GAP accelerator, trying to coordinate all the agencies that work in health so that they get their acts together. But this is in Geneva. We have to figure out how to do it in the countries. So we have a lot of challenges, but I want to remain optimistic and hope that we can deliver. Having said that, I think an important part of leadership is really taking responsibility for your growth and learning, and also unlearning some of the internalized operations. No one can do that for you. It's also waking up and saying, I don't have to accept that, right? Just because things are this way, you don't have to accept them. So for me, if we're going to make progress, whether it's in 10 years, 15 years, or 5 years, we need to get very comfortable making others uncomfortable. Yeah. And that's not easy.
Beautifully said.
Quickly building on what Paul said earlier, talking about academic progress, he said, when we're trying to promote faculty, we're not saying to our friends, I'm trying to get rid of you, but I'm trying to bring more friends. I'm sorry, Paul, I'm going to disagree with you. There is a limited resources. You have to get rid of somebody to replace somebody. Right. And we have to be uncomfortable saying that.
Right.
And I think global health has a lot of work to do. I mean, I can say more, but people are flagging for you.
Great.
But if I say one more thing for the wrong people in the room, please do not apologize for making other people uncomfortable. Claim your space and your time, and if they don't invite you, as Madeleine Albright says, bring your chair.
Great, bring it. Whoa, standing ovation. Paul, last words. Each of you, a moment.
My last word is amen.
Yeah, great. Wenya.
Last thoughts. I think I had an interesting conversation this morning about decolonizing global health. And again, decolonizing global health. And again, I have to commend our host country because they really do take ownership. We're having this conversation about donors and who should own the conversation. And Rwanda has been so unafraid to own that conversation with the donors. I really do have to commend them. The conversation doesn't have to be negative. The conversation doesn't have to be something that we're afraid of. We're not saying we want to end our relationship with you. We just want to change our relationship with you. Okay. Let's talk about less about aid and more about trade.
Beautifully said. Rupa.
I think I've already said my closing, but I want to say let's continue to work together for collective action till we have truly gender equality for everybody so that all genders benefit. Thank you.
Great. Thank you. Please join me in thanking this brave and wonderful panel for everything they've done. Thank you.
All right. Once again, thank you so much to our speakers and chair, passionate and dedicated advocates to women's health and equity. You've really challenged us. I know you've challenged me in your unapologetic commitment. And to the rest, there's another question? I don't think so. No. So I'm so sorry. I'm getting a solid no. She's a... What do you want to do? I'm getting a smile. Okay, I think... Okay, we'll just be very brief. Okay.
Ladies and gentlemen, I'm very sorry, but we are going back to Beijing 1995. Beijing platform 1995 had no platform for women with disabilities. Now I've been holding my hand up all afternoon. Nobody sees me, perhaps because I can't see you. And then you are very sorry, just like all the donors tell us. We are very sorry. I'm very sorry. I got annoyed. But I think it is very natural to be annoyed. Anyway, getting annoyed in front of our First Lady. I'm sure she would get annoyed anyway. So I was just going to say that we had Beijing 1995, the Beijing platform. There was no platform for women with disabilities. When we asked for a I wasn't there, but I got a report. When the platform was asked for, they were given 2 tents and only women with disabilities in the 2 tents. So that means they talk to themselves. Today we are 25 years after Beijing. We are talking about mainstreaming gender. And the gender we are mainstreaming does not mainstream disability in the gender. Even in Rwanda, we are talking about disability being a cross-cutting issue. But you don't have disability in the gender mainstreaming policy. So that means that disability is not being mainstreamed. When shall we find ourselves being in the national policies, in the health policies? How do you help a woman with a disability who does not understand why they're having a problem getting babies, or why their disability is increased by the fact that they had a baby? How do you help a woman with disability who is being forced to have a baby so that she can have a guide, so that she can have a caretaker? How will you help a woman with a disability who is being forced to abort because nobody wants to take care of that woman's child? Who will help us? That's my question.
Thank you so much to our courageous speaker. Just so you're aware, you had a standing ovation. So thank you so much for sharing that. To the rest of the group, thank you again for your participation, and continue tweeting and sharing using the double LGH19 hashtag. We'll see you shortly for the next session. Thank you so much. Thank you.
Good afternoon, everyone. So the next session will be in here, and if we can please take seats and proceed with the next session. Yeah. No, it starts at 4:50. The speaker. Yeah, we apologize about the time. We went over time, but I think the next session is going to be starting shortly. Thank you. So I would like to ask the chair of the next session, Sarika.